Hi, my name's Ed Shanshala. I'm the CEO of Ammonoosuc Community Health Services. At ACHS, we provide primary preventive health care. We do so that each of us can stay healthy. Why each of us stay healthy is a very personal and unique story. The following is a personal and unique story of one of our friends, families, or neighbors and why they stay healthy.
I had an ACL rupture when I was active duty in the Army, and that resulted in, an ACL reconstruction. But certainly when I'm skiing, I'm always wearing a brace, and I'm just very, very conscientious about, my positioning, and I'm a fairly aggressive skier. So I tried, to make sure that I'm not pushing the limits. When I was flying active duty in the Coast Guard, we had to wear a dry suit. I was in the Pacific Northwest for the majority of my flying career. And just the repetitive motion of, having to, wrench my arm around to get into the dry suit, over time, from just that repetitive motion, both left and right shoulders, I ended up with partial rotator cuff tears on both shoulders that I completely tore my left rotator cuff very, very significantly. And that, I had to have reconstructive surgery done. Even though the recovery on my left shoulder has gone very well, there are things like weight from here up is still really stresses that joint. So I think of alternate ways to move stuff. Right now my right shoulder is strong enough that I can do those kind of things without that, straining my left shoulder. So all of that was documented. And as a result, that was all recognized on my VA disability when I was discharged. So I would encourage veterans to make sure you go through the efforts. The VA can be kind of frustrating. They're very busy, overtaxed, but fortunately for me, just being patient, following through with it, that resulted in, the recognized injury and the disability. It kind of eases the pain a little bit when, I kind of, whine to myself about, if I hadn't had my knee injured in the Army, I wouldn't be, it happened, and I can't change that, but it's, that VA disability does help to cushion that a bit. And then the other thing that I would, encourage veterans to think about is, just maintaining their Tricare for as long as they can.